with Amelia here with me, as you've seen her before. And this week we're going to talk about back pain, low back pain in specific. Amelia came to me and said, I'm dealing with some low back pain. We thought this was a great opportunity to illustrate or demonstrate rather what we do as far as evaluating low back pain, because it's a pretty nebulous idea. When you think about back pain, you want to think about three major areas. You got the structural, which is what people mostly think about back pain, the biochemical, or insides come in the outside, and then the neuroemotional. So we're going to talk about those three areas. And stay tuned for next week. We're going to talk about memory in case you forget some of the stuff we talk about this time. Don't worry, it'll be recorded and you'll be able to get it later, but we'll talk about memory next week. All right, so Amelia, tell us a little bit about what you've been dealing with.
I feel a lot of tension in my low back, especially when I'm laying down, and just generally throughout the day it just feels tight.
Okay, very good. All right, so generally speaking, you would take a look at the body and say, all right, is there any excessive curve in the back, things like that. You know, she already alluded to the fact that laying down is problematic for her or causes her pain in normal people's language, but I say problematic. So we want to basically evaluate her. So I want you to have you lay on your back. And this thing will make some noise because it is a machine. Nice mom for you. It's on. Going up. Alright, so just laying here, does it make your back pain worse?
I feel it like in the mid-back, around my spine.
Okay, so in the middle of the spine,
Yeah.
middle of the back. At what level?
Mid to low.
Okay. So right about here?
Yeah,
Okay, not down here.
not quite, no,
Okay,
it's a little bit higher.
So that's right about the T12 area, and that's going to be in my world, it's going to be the diaphragm. So when you think about the diaphragm, it's a breathing muscle, and it's right underneath your ribs, and it attaches at your T12, which is where she's expressing the discomfort is feeling or showing up, if you will. When people think of low back pain, they think of either a spot down here or a band across the back, which is usually a problem, okay? In our world, in the kinesiology world, we're going to test some muscles, all right? So we're going to look at her core first of all, okay? The core is the most important portion. It's the abdominal muscles, okay, because it's a core stabilizer. So what we're going to do is we're going to test her QL first. So the feet stay up, bring your legs over here. You can hold on to the side of the table. Good. There you go. Now you're going to keep your feet here without pushing that hip up. I want you to push toward me with your feet. And without very much effort, she's weak. Okay, let's try the other side.
Okay.
Okay. Feet straight up. Hold there, don't let me push. And that same thing, okay? So now we're just gonna ask a question. What I want you to do is pull your belly button back to your spine and hold it there. And bring these over here and push toward the window. All right. And would you say that's stronger?
Yes, definitely.
Okay. Now what I want you to do is push your belly button toward the ceiling. And then hold your legs here. All right. And that makes you even more. Okay? All right. Fine. So what I want to do is just see if the diaphragm's involved at all. So right now, holding here, don't let me push. Okay, that's pretty weak. So what I want you to do is take a deep breath and hold it. And then push your legs toward me. Okay? And that strengthens her again. Okay, breathe normally. So that's just a different way in kinesiology where you can turn a weak muscle on from adding in a variable. We just added in the diaphragm to see, is the diaphragm involved in this particular case, okay? So we might do a therapy where we come under the ribs, okay? We would we would use something like the vibrocussor on a very low setting. If any of you have been in here before, you know that we work on the diaphragm quite frequently with people. It's a very common area. We use a lot of tools because, as one of our team members says, we don't like to whip and crack. We do a lot of things that are strategic and almost like a scalpel rather than a sledgehammer. So we want to be very strategic about that. So let's just test the rest of your muscles on your core. Sound good? Mm-hmm. Bring your legs over here. Flip that foot down. This one stays up. Hold there. Don't let me pull. And that one seems okay. Both these feet point that way. Push toward the window. Don't let me pull. All right. And that's not very strong. Point both feet this way. Push toward the window. And that one's okay. All right. So we're just checking the multifidi and the transverse abdominis, a bunch of muscles you don't need to worry about because that's my deal. So obviously we found some weaknesses so far. We do know that when she lays on her back, it's painful. And oftentimes, when a person lays on her back and it's painful, if you bend the knees, that will allow the low back to flatten out, which will take some stress out of it. Now, generally speaking, if someone were in acute pain or really sharp pain, I would say sleep with pillows under your knees. It's an easy fix, right? So that might be a good idea for you.
Sounds good.
Okay? Provided I don't fix you when we're done here.
Okay.
Right? All right, so we can also test some more muscles. If you know anything about the spine, if you've ever seen a model, what you want to appreciate is there are muscles on the front of the spine. Most people don't think about the spine and the muscles related to it, but this one's called the psoas. It's P-S-O-A-S. It's a pretty fancy name. What it can do is it can pull your spine down like that, which does not look like it's very comfortable. It'll tilt your pelvis. It'll cause you a lot of compression, a lot of pain in your low back. Right about through here, where this muscle ends, is where her diaphragm attaches on T12, right through here. This is the 12th thoracic vertebrae. So that's pulling her down. Her psoas is pulling her down probably, so we're going to look at that now because that's probably causing her body to not move very well. So let's just test your psoas. So we're going to bring the leg up, bring it out, and keeping the foot out like that. I just want you to push up toward the ceiling, okay? And you notice that's pretty strong, right? Yeah, pretty good. Let's bring this one around here. And you're just going to push up toward the ceiling. Don't let me, not that way. Straight up.
Oh.
So that's where you know they're trying to cheat, and that's where you see it's weak, okay? Because she knew, her brain already knew it's going to be weak, okay? So the psoas muscle runs along the spine. It attaches on the inside of the leg called the lesser trochanter, but that's not a very important thing for you to know. So in here, you probably can't see her face from here, but she's not a happy camper. There's a lot of tension in there. So I'm just asking, is that directly involved? Keeping your foot out, I want you to push straight up. Don't cheat now. And would you agree that's stronger?
Mm-hmm.
Okay. So we already found out we need to treat the diaphragm. We have some tension in the psoas on this side. I suspect that the right side's actually super tight. The left side was weak. The right side's probably super tight. So then what's called strain counter strain. So you bring the knee up, pull it toward your shoulder with your own force, not your hands. Okay. Now straighten it back out. Turn out, and now push straight up toward the ceiling. And how strong does that feel? Not very strong. That's called strain counter strain. That's really just stressing the muscle and saying, can it maintain its strength once it's been stressed? Now obviously we can see that's not happening. We can test the groin muscles. So there are also different acupuncture meridians that relate. You can check the liver, the kidney, and the spleen meridians, depending on which angle you have the feet. Just depends on how far down the rabbit hole you want to go. So we'll turn the toes in, and you're going to hold your ankles together. You're going to keep the toes up, hold the ankles together, turn the toes out, hold them together. And what you see there, a little bit different. She's trying really hard, okay? So then you could come up and you could do contact reflex analysis and figure out, all right, so that's probably, we'll use a reflex point. Put your finger in your belly button. Okay, so right up there. So I want you to put a finger on that spot right there. Okay, you can take this one down. Oh, let's just do it both sides. Put the other one in there. Good. Now I want you to turn the feet out like you had them before and hold the ankles together. Got it? Don't let me push. All right. Now, pretty dramatically different, right?
Yes.
So that's just a way of looking at, so she's got some kidney stress. Not a pathology, not a disease, just some junk in there that can't get out, maybe some stress, maybe some fear, who knows, depending on what the neuroemotional thing's going on. All right, so we've already found a lot of stuff going on. The diaphragm being tight is a good indication that there's some stress going on, whatever it might be. Might be related to kidney, might not be. But these are just some different things you can look at. Okay, so we've already evaluated the core, we looked at the diaphragm. We can see if the lower core is affecting the upper core, so we can tie this into the neck now, so you can hold your chin there, tuck your chin. Hold there, don't let me push. And she's not very strong. All right, try this side. Okay, hold that there, don't let me push. And once again, okay. Now just for giggles, pull your belly button back to your spine again. Hold it there. And hold your neck there. Don't let me push. And what would you say about that right there? I'm pushing pretty hard, would you agree?
Yes.
All right. So we know now that at the very least, the low back is contributing to weakness in the neck. So you have a global issue based on probably a local challenge there, all right? So if you were doing kinesiology, you might test the hand here and have her push toward her head. And you might come into the low back, you might push forward on the sacrum, and she doesn't like that at all, okay? But if I push down, okay, and she holds, okay, there's no change, which is probably making it stronger. Okay, and you're gonna hold. So you can just test the different segments. This is muscle testing, which we're not going to get into, but you can get an idea of, there's no limit to how you test the body. The body can give you the information you need, you just have to be willing to ask as many questions as necessary to get to the root cause. Okay? Has been getting up and down from a lying position been a problem for you?
I don't know, let's see.
Alright, well, I don't necessarily recommend that Julie jump up like she just did. Generally speaking, we like people to lay on their side and roll onto their back. It's much easier, okay? So
Yeah,
since
that
you're-
wasn't a good idea.
that didn't feel so good. Alright, good job. Alright, cross your arms with your hands on your shoulders. Now I want you to twist to your left and tell me if there's any pain or pulling going anywhere.
No,
Okay, turn to the right and hold there. Any pain.
Yes.
Where do you feel it?
right here.
On this side. So it's
Yeah.
on the left side. So she's turning to the right, activating the multifidi muscle in part. And would you say it's right along there?
Yes.
Okay, very good. So, alright, fair enough. And now let's turn to the middle and tip to your right. Any pain or pulling?
No,
Alright, tip to your left. Any pain or pulling? Or jamming?
not really.
Alright. So let's just test those muscles. Turn this way. And you have some pain over here.
Mhm.
Pain will inhibit the brain. It will shut things down. So we'll just ask if she can hold there. Don't let me turn you. Okay? And she's not very strong. Okay, now turn to the left, which is the side which we expect to be weak because there's a pain over there. You're gonna hold there and don't let me turn you. And what you'll notice is I can put a lot of pressure, it doesn't weaken there. Turn to the middle, tip to the left, hold there, don't let me tip. There, but that is weak, okay? Now that's her core, that's part of her QL, quadratus lumborum. Hold there, don't let me tip. Awesome, okay, so that side's working fine, but it's probably over tight. So what we can do is we can tip her and have her hold, push down for 5, 4, 3, 2, 1, come back up, and tip back to the right. Now I want you to hold there and don't let me tip you. And what you'll notice is, it doesn't work so well, okay? She's trying really hard, but this is how we can test. Even if something seems like it's strong in kinesiology, you always want to make sure that it's not over tight because that can give you a false negative, okay? Now, let's think about the low back here for a second. We're talking about the kidneys in Chinese medicine, there's fear. In Q&RT world and Germanic medicine, we can talk about feeling a lack of support, unsupported, or lack of respect somewhere in there. Those are different things that can possibly be in contributing here. There's a bunch of different things you can look at. So we want to make sure that we address that because if you're going to treat the whole person like we do here, you're going to want to understand what is affecting her, whether it's something she's processing from a family standpoint or friend standpoint, work standpoint, hopefully not. Or is it something biochemical, like is she constipated and that's causing the nerves of the digestive system to reflex back to the spine, and as they send their message up to the brain, it actually leaks out into the muscles and then irritates those muscles and causes her to be weak. Okay? Right now we're pretty sure the kidneys are involved rather than the GI, but we could easily test that as well. So we might do something, we'll do some tapping here. So let's just go with turning this way, crossing your arms and hands on your shoulders, take a breath in, exhale and turn to your left. Okay. So we're activating specific muscles, breathe in, exhale. Amelia didn't know I was going to do this here, by the way. Breathe in, exhale. Good. All right. Now turning back to the right, tell me what your low back feels like now.
Feels better, it's not as much tightness.
Okay, now hold there.
Okay.
Good. Now come back and hold there, don't let me turn you. Good, now turn this way. Push that way. That's strong, so keep pushing. Come back up the middle, tip back to your right, and hold. All right, so clearly it addressed the rotational portion. Hold here, don't let me turn you. All right, so everything's stronger rotation-wise, but the lateral bending, which could easily be fixed. And you want to have some tools, or you want to have your doctor have some tools other than their hands, because sometimes you need to stimulate the muscles and the nerves and things like that in a way that is a little bit more disruptive to their pattern, because the muscles, of course, get their signaling and give signaling to the brain. So you want to use things that are like the vibrocussor or the arthroStim or the pro-adjuster or the percussor, I think it's called. So let's do this. Tip to your left, take a breath in, tip to the right. Okay, and come back, breathe in, exhale. I really call it therapy. It's not always going to tickle. Deep breath in, last one. Tip all the way as far as you can go. There we go. Good. All right, now tip back to your left and push as hard as you can go. There. Now, I'm pushing pretty hard, and I'm letting go so you can see just how much she's pushing, kind of for a dramatic effect. But you get an idea of more rather than just watching push and let go and things like that. You felt stronger?
Yes.
Okay. Did it feel any pain?
No, not as
Okay.
much.
All right, fantastic. So we've already addressed a little bit. It's going to give her some relief right now. But these are just some of the things you want to take into consideration. Remember, if anybody's going to take care of you or guide you through your healing process, you want to make sure that they're addressing the three main areas that can affect any part of your body, right? Structural, which we just addressed partially. The biochemical, we know there's some kidney stress, you might want to use a kidney drainer or something like that, get to the root cause, whether maybe it's a structural, biochemical, energetic, emotional, allergy, tox interference, or infection, something like that, microbial imbalance, we like to call it, can affect the kidney. And then also the neuroemotional. So what conflicts are there, what stresses are there, where does she feel like she's not getting the respect or support, if that were even part of it. But we always want to make sure that, and we don't tell that to people in order to make them feel like they have a problem. We actually feel like it's enlightening so they can understand where the conflicts are and they can then resolve those, go about resolving those, because again, as we said time and time again, the quality of our relationships is what determines our health long term, and therefore if we can address that in the short term and make sure that our health is good and our relationships are solid, you're gonna have many, many fewer health issues in the future. So it's really important to understand that. So if you have a relationship that might be nagging you, do whatever you can do on your end. You can't control them, just do what you gotta do. And then if you need help not reacting to them per se, then that's where we jump in with QNR team, stuff like that. So just keep that in mind. We hope this has been helpful for you to get an idea of how you can look at the low back in this particular condition and see how it's affecting everything globally, right? So it's affecting everything from her legs to her neck to her low back, her core stability. So when she's going to the workout and stuff like that, it's shutting down, right? She did the Julie jump up, or if you're a guy, you're the Johnny jump up. You don't want to do that. You want to lay down on your side and roll onto your back. Okay? You probably think that's like grandma style, but it doesn't matter. It's going to save you from having pain and suffering. If you have low back pain when you're laying on your back, make sure you put your knees up, put something under your knees to support that so you can hollow out the low back and take some stress off of that. That's going to take the most pressure off those facets and the different anatomy things in the low back. It's going to help you make you feel better and help you sleep through the night. If we can be of any assistance, certainly let us know. Shoot us a comment, let us know how you'd like us to expand on that, or if there's any questions you want answered based on that. It's really important we get your feedback because we want to produce things that are beneficial for you, that empower you to understand your body, and so you're not just a spectator. It's not a spectator sport. We want to appreciate that your body is yours. It's your vehicle, and you don't have to be a victim though. You don't have to have your symptoms going crazy and feel like you gotta walk on eggshells or carry yourself in a way that's not going to be painful. We want to get you back to feeling good. I think Amelia, you can do burpees, don't you?
Yeah, sometimes.
Yeah? Okay, fine. I was using a joke because most people hate burpees, but
normally not.
Do whatever you want to do. Whether you want to go rowing, biking, hiking, lifting weights, jumping rope, burpees, whatever it is, whatever you enjoy. Playing with the kids. I'm going home to play with Sophia here in a little bit, so it's important that I am not crippled myself when I get home because she likes to be thrown around, and we like to go out and have walks and look for bunnies and stuff like that. But that's an aside. So share this with your friends and family. Let them know that there are very important things that they should take into consideration when they are experiencing low back pain. Very rarely is it ever the low back. I can't tell you how many people say, I just woke up with it, or I was leaning down and all of a sudden, whoa, you get that whole twinge. You've probably heard the story from your uncle. He got it, his slip disc or his lumbago or something. There's all kinds of funny words. My sciatica, I hear that all the time. My sciatica, okay, where it's really just the joints are being compressed, all right? It's not to take away from what you're experiencing, but we need to get to the root cause of it and help you understand what's going on in your body and let you know that it doesn't have to be that way for a long time. Because if you ignore it and hope it goes away, eventually your body's just going to adapt to that injury, and you're going to get stuck in that pattern, and you're just going to finally adapt to some way of walking around, and it's not going to be pretty. Okay? So you want to make sure you get to the root cause. So let us help you do that. We're here to help you. Give us a call, shoot us an email, whatever we can do to help out. But yeah, share this with your friends and family. And again, please ask us to answer your questions. Ask us for information. Ask us for tools, stretches, whatever it is. It doesn't matter. We're here to support you. We're here as a resource for you. We want to put out the most important content for you that really enhances your life and helps you, avoid disease, promote your health, and enhance your quality of life. That's really what we're doing. Prevent disease, promote health, and enhance your quality of life. That's our job. So keep that in mind and let us know how we can help. And we'll look forward to seeing you next Wednesday. See you guys.